Greetings, everybody. This is the seventh and final installment of the bulletins that was social service and infrastructure perspectives on the state of the nation addressed by our president. So just let's recap some of the achievements since 1994. These include free healthcare for pregnant mothers and children under the age of 6 years old. Social assistance continues to be a lifeline for more than 26 million South Africans who get some form of social assistance every month. Building on the success of the expanded public works program, the state has launched the presidential employment project. Through this project, we've created more than 1.7 million work and lively opportunities. At the end of apartheid, only 6 out of 10 South Africans had access to clean drinking water. But today the figure is almost 9 out of 10 South Africans. SONA priorities for the SSI cluster, social security cluster, social service and infrastructure cluster is NHI, the implementation, incremental implementation, rollout of the GBV plan, extension of the social relief grant as a measure against poverty, publications around the visa reform, implementation of border management, ensure that improving technical and specialized skills for work, public work and infrastructure and property management, deepen coordination and seamless working partnerships to ensure for infrastructure in our communities, process implementation, modernization, fleet renewal, and as well as safety and security, high-speed rail connection approved by cabinet. So these are some of the issues. Let's start with health quickly. Key oversights is that we need to focus on the preparedness of future pandemics. COVID has highlighted the importance of building a resilient health system to deal with challenges, which is more intense and more frequent, monitor the development of health infrastructure, and also ensure that we deliver quality, good health services to our people. Progress made to achieve our HIV targets. We want to ensure that 95, 95, 95, which means 95 people living with HIV know their status. 95 people who know that they're living with HIV are enrolled with antiviral percent, and 95% of people on treatment have virally suppressed loads by 2025. This is important target. Climate change, I think we spoke about gradual implementation of the national health insurance, or its lessons around collaborative efforts. We note that there's more than, I think it's 200 or 2,000 doctors that's not been implemented or not employed. Something that needs to be done around this, but we need to get all hands on deck to ensure that NHI is and realized progressively. We need to improve quality and access to healthcare, both in the private and the public sector, dealing with health system, finance, work, medical products, vaccine, information technology. So those are all the key issues that we need to deal with. In terms of social development, the grant scheme continue to be the most effective ways of dealing with poverty and inequality. So therefore, Parliament should continue monitoring progress, expanding the safety net, and maybe we look at new ways of innovation of dealing with basic income grant beyond the exploration to actual implementation. Now we know we don't have money for it, but it's something that is dire. Food security is a key issue. I think we did speak about SRD continuation, and we need the next steps towards income support for all unemployed South Africans, because whatever we do, we won't get universal employment going forward. Home affairs, issues around the visa system need a key overhaul. We need to attract, recruit skills in the economy. So therefore, we promote innovation. So therefore, the visa reform is critical. We need to manage the new border management authority, understand their roles, their targets, and ensure that they deal with illegal migration. And we also deport those potential illegal immigrants. We need to ensure that documentation is expedited. Work visa strategies, skills retention is dealt with. Border management transfers is key. In terms of human settlement, we need to monitor the implementation of the infrastructure development program. The infrastructure fund is 100 billion allocation for the fiscus over the next 10 years. To date, 34 out of the 50 strategic funds have been in some form of implementation stage, accounting for 281 billion of this total 340 billion. This catalytic projects to the value of 21 billion has been started, and of this 22.6 billion is contributed by government and the balance in the private sector. We need to ensure that there's oversight, availability of well-located land for subsidized housing to ensure that the poor households are located closer to economic opportunity and therefore transforming the apartheid spatial landscape. I think that we have said this so much, we need to ensure that we actually do this as a matter of urgency and identify land closest to our towns. We know that the dynamic of Boerdorp, Buitendorp and Onderdorp and the spatial apartheid planning is still the same. Well located land, we spoke about that. The president announced this infrastructure fund, progress around human settlement in regard to this, the multi-million rand social housing fund by the social housing regulatory, namely the social Goodwood Station social housing project. So those are some of the key issues. The gender-based plan we've spoke about, improve the technical specialized skills of property management. We've also mentioned that. Progress to date, transport, key oversights as recovery of PRASA, monitor PRASA's capital expenditure. PRASA should also provide Parliament with regular updates around location, the corridor line in the Western Cape, the Central Line, Sandral, regular briefings, and also updates on the framework for the high-speed rail network. Priority areas for transport is the recovery and modernization program, revitalization of services in KZN, rollout of the integrated security plan. Those are some of the key highlights that I thought was useful. This concludes the breakdown of the 7 installments of the different bulletins for the State of the Nation. I hope this was helpful. Please give me feedback, give me comments on the and suggestions on how we can do greater oversight, greater monitoring to ensure that the executive is held accountable and ensure that we do deliver for our people and we indeed leave no one behind. Thanks for your kind attention.